Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Hey there.
Hi, Brittany.
My friend, Dr. Moya. This shouldn't take too much of your time today, but a question that has been coming up more recently is why is it that we're not able to prescribe or send the prescriptions for upcoming surgeries to our out-of-town patients who are coming, from a couple of states away or wherever? Why is it that we do not do that?
That's a great question. So, number one is because it's my preference, meaning, especially when it comes to narcotics, and I'm going to get into some states just don't allow us to do it, but let's just say they all did. My biggest issue has been, and it's happened before, that you give these prescriptions out, patients get them filled. They got a lot on their mind. They're going to fly across the country. They're going to have these big surgeries, getting all prepared. And all of a sudden, next thing you know, when they get here ready for surgery, hey, where's my pills? That was a big problem. And then we had to re-prescribe that. And then that was always frowned upon because now you have another set of narcotics hanging out somewhere. That would have been, if it was just that easy, that would have been one thing. But now the laws have changed.
Right.
Now we run into that if that happens to one of my poor patients, they may not even let me refill it for them.
Right.
That's how strict the opioid issue has become.
Yeah, the regulations.
The regulations become so strict that if that happened, I may not be able to prescribe an opioid narcotic for them.
For like 10 days or 14 days.
So then we run into issues, what are we going to give the patient? So that's the number one reason. Number two is now the laws have changed. A lot of states don't allow us to prescribe, from one state to the next. Right. Because my license is not going to work that way.
Or like there are too many states away. Like maybe if it was a neighboring state, it might be okay, depending on their rules.
It depends on the state's rules. So we found a lot, for instance, like California, our patients, we can't prescribe anything over there. Texas. So it's becoming more and more, and I guess it's because of the opioid issue is the reason why states have cut down on that and cracked down on that.
Right.
So,
which is a good thing. But
yes, it's all about safety. But that's the main reason. So when it comes to narcotics, that's the main reason we do not prescribe any narcotics before patients get here. Worst case also, you prescribe a narcotic and the case gets canceled for some reason.
Right.
Now you have a prescription that's out there.
Right, floating around. Yep.
Exactly. So we have our preference when patients get here. We just don't give them a prescription and say, go get it filled. Because when it comes to what we prescribe, there are certain pharmacies that we find are easier to deal with than others. Right. Again, because of the narcotic issue, the opioid issue.
Right.
And I think we touched a little bit on a previous episode of what my preference is in the combination of drugs.
Right.
So when it comes to my main one, which is the extended release narcotic, that one is the one that's very controlled of all of them.
Right.
It's technically only supposed to be prescribed for patients who have chronic pain.
Right.
At least that's what.
Or end of life.
That's the category they put it in. I have been using it a lot longer than whenever that rules came up because it worked very, very well for acute post-op pain if you do it the right way. That one has been very hard, meaning it has a lot of hoops that we have to jump through sometimes to get it filled. So for patients who come in and say, well, I'm just going to get a prescription. Hopefully, my insurance is going to cover it. The answer would be yes. They're going to cover short acting. They're going to cover an anti-nausea. They're going to cover a blood thinner, but they're not going to cover the extended release that I prescribe because it doesn't fit under the diagnosis codes of chronic pain or whatnot.
Right.
So that one actually has to go through sometimes a denial process by the insurance before the patient can even buy it as a self-pay.
Right.
So we do have a pharmacy that we prefer to prescribe here. That's a little bit more friendly with the patient in regards to not maybe having to go through all those hoops, knowing that's going to get denied, allow them to pay for it right off the bat.
They're just so used to dealing with our
rather than have
patients.
to do more paperwork when they're going to end up paying for it out of pocket anyway. So,
Yes. I think they're more concerned about like time frame. Is there enough time to get their prescriptions filled prior to surgery? Like what,
Oh yes. For most of my out of town patients, I mean, we try to make arrangements so they're not in town 3 days before surgery. Or 4 days before surgery. We'll get them in town so that at least we can see them the day before surgery and get them ready for the surgery, which includes writing the prescriptions. Everything is electronic today.
Right.
So it's not like they're taking a prescription over to the pharmacy.
Right.
As soon as you hit that button, boom, it sends it to the pharmacy. Right. So the pharmacy can get it ready while they're even still talking to us.
Exactly. And they fill it very quickly.
Correct. You don't have to worry about any of that. It's electronic. It's quick. It's there for them to pick up the night before surgery.
Okay. I think that pretty much answers it. Like I said, that was just a quick little question that we've been getting a lot. So thank you.
Well, you're very welcome. Thank you.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the course of body lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.